we're starting to see this rapid increase in cases both here in Lucas County and in northern Monroe County. What do you blame for this rapid increase, and how can people avoid spreading the virus when it comes to these variants?
Yes, about the variants have probably been out there longer than we know about, and the exact prevalence of the variants are probably greater than we're estimating right now. It's because we can't test every single case. It's not feasible to test every case, and there are certain conditions that need to be met in order for us to test people, even if we would predict that they might have a variant. But we know that they're around us, and we know that by doing random sampling, we can extrapolate numbers and see that a large amount of this surge correlates with the rise in the prevalence of the variants. And the variants are more contagious, they're slightly more deadly, and it's more or less a race right now, Jaden. So we're trying to get people vaccinated as quickly as possible because we believe, based on the best evidence that's out there, that the vaccines are safe and effective against these variants, and they're going to prevent hospitalizations and death. So it's all about trying to do things that help combat the more contagious version of this virus that we're currently seeing, and the fact that it is spreading more rapidly right now.
Another concern that is being brought up now is the fact that older adults and anyone over 16, really in Ohio, is able to get the vaccine, but those 16 and under can't get vaccinated, which allows for the virus to spread amongst those 16 and under. So how do you think people that are under 16 can help stop the spread?
Yeah, it would really be nice if we were in a position where we could vaccinate the entire population, and if we knew that that was safe and effective to vaccinate those who are less than 16 years of age, but we just don't have the clinical trials to support that yet. And the last thing we'd want to do is launch something that has not been tested with the rigor of clinical trials in order to prove that it is safe. Now, scientifically, we believe that it is going to be safe for the younger age groups, and trials are underway, so there is going to be more information coming out, and we believe that very soon we're going to hear about that 12 to 15 age group, which brings in an entirely new population of people that will be eligible for the vaccine. But until that time, we still need people to be adhering to those preventive measures, especially those people who are adults or the 16 and over who have not had the opportunity to get vaccinated or are still deciding whether or not to get vaccinated. So aside from the vaccine, the best tools that we have are the usual preventive measures of hand washing, masking, and keeping socially distant.
A lot of elected officials have been saying is that they expect to have normalcy returning in the summer for those large events that we've come to expect during the summer. Do you think that is feasible at this point in time, or do you think it's going to take more for that to happen?
All of our lives have been changed, and even if things were to turn off tomorrow and the virus were to go away, we would still be talking about this. It would still be a part of who we are now. So I think that a good focus is to look at what our lives are going to be in the post-pandemic phase. So we're still in a pandemic. There's enough widespread disease and there's enough mortality that by definition, we are in a pandemic. There will be a time when we're no longer in a pandemic, but we will have been changed on the other side of that. So I don't believe that COVID is going to go away entirely. It's going to be a disease that we're still going to hear about and see to some extent, but life will be different. Things will get better. I believe that a lot of these measures that we're all fed up with, the masking, the socially distant, and then the restrictions that are in place, I believe that those will go away at some point in the near future, and we're going to enter a different phase. It might be different than the one we're currently in now. I do believe that it's going to be associated with a greater degree of social interaction and less restrictions, but it's going to be a post-pandemic phase, and we're just going to be different. We're going to be affected by having gone through what everyone has been through.
For those people that are hesitant about receiving the vaccine due to its side effects, what is your message to them?
I would ask them to take a deep dive into what is actually happening to most people that experience the side effects. In my world, we make a distinction between an adverse reaction and a side effect. An adverse reaction is something that you don't expect as a result of receiving the vaccine. A side effect is something that you generally would expect when receiving the vaccine. There are many people who experience side effects, and by far and large, they're generally benign and they're predictable. So we know that with most of the vaccines that are out there right now, especially with the second dose for that 2-dose regimen, many people will experience some fatigue, some muscle aches, some body aches, and even a low-grade temperature. And then it goes away very rapidly. In most people, that's about 24 hours. And we would consider that a small price to pay when you look at the big picture and the overall risk of getting COVID. So that is side effects. There's an even smaller percentage of people that will have an adverse reaction. And even those who do have an adverse reaction, like fainting or an allergic reaction, those things are very treatable. They're brief, and almost all people who have experienced those to date recover completely. So when you look at both the side effects and the adverse reactions that people experience from the vaccine, in comparison to the overall risk of contracting COVID, there really isn't much of a decision there in terms of what's better to go through. And so I would ask people to look at the facts that are out there, to talk to trusted sources and people that they know that have had the vaccine and have been through some of those experiences, and to really follow the science, and to hopefully decide at the end to play their role in the community and protect themselves and the people around them. And I do know, Jaden, that one clinic with the Johnson & Johnson that just made the headlines today in North Carolina, my understanding is that the officials there that were going through the clinic have made that decision out of an abundance of precaution to make sure that there isn't something unexpected happening in that individual clinic. But even for the Johnson & Johnson, when you look at the hundreds of thousands of people that have received the vaccine, the percentage of adverse reactions or serious side effects is extremely low, especially when you compare that to what your chances are of experiencing an adverse outcome as it relates to contracting COVID. So we would still recommend that people receive the first vaccine that becomes available to them.
Pfizer is now applying for emergency use authorization for their vaccine for those 15 and under. How soon do you expect that vaccine to be approved and for people that are at that age to start taking it?
I know that Pfizer released a statement that said they plan on applying for the emergency use authorization for the age groups of 12 to 15. I don't believe that that's happened yet. At least last I checked, and in the better part of this day, that hadn't occurred yet. And so we don't know exactly when that's going to happen. I'm sure that they want to have all the right data to be able to submit so that it will be a successful submission. And I believe that can be measured in days or weeks, and probably not months. And then as soon as that emergency use authorization is granted through the independent council and the FDA releases it, then we can begin vaccinating almost immediately.
Is there anything else you would like to add?
I would just say that there's plenty of vaccine clinics out there that are available. And I think that we're very lucky in Ohio and Southeast Michigan to have available clinics that are out there that you can register for today. Jaden, I have a daughter that lives in California and in Los Angeles. She still can't get vaccinated. She's 18 years old and they have not opened it up to her age group yet. So even though she's a willing participant and would love to sign up today, she can't. But if she were in Ohio, she would be able to. So anybody that's age 16 and over can currently sign up to get a vaccination. So I would just encourage everybody to go out there and do it so that we end up in a much better situation than we could be if we have hesitancy and people that are still deciding whether or not they're going to. If you're thinking about it, please just go out and get it.
Dr. Brian Kaminsky of ProMedica, thank you so much for your time.
All right. Thank you, Jaden.
Thank you. You have a great weekend.